Did you know that research published in 2022 found that up to 80% of connections between the ear and the brain can be lost before it ever shows up on a traditional hearing test? You know, the test where you sit in the booth and listen for beeps and press a button? While that test is important, it doesn't give us the whole story. This is one reason why so many people are told that their hearing is normal, yet they still struggle to understand conversations, especially in background noise, or experience symptoms like tinnitus. I regularly see patients who have been told elsewhere that nothing can be done because their hearing test was normal, even though they're clearly having difficulty hearing and communicating. That's why we take a more comprehensive approach to hearing evaluations. In addition to traditional hearing testing, we perform otoacoustic emissions, which can detect early cochlear damage before it happens on the standard hearing test. We also use tympanometry to evaluate how well the eardrum and middle ear system are functioning. And then most importantly, we assess how well your brain is processing sound by measuring your ability to understand speech in quiet and in background noise. These tests help us identify where communication breakdowns are occurring and give us a much clearer picture of your hearing health. When the connections between the ear and the brain begin to deteriorate, it's important to keep the remaining pathways active and stimulated. Identifying and treating hearing difficulties early can help reduce the long-term consequences of untreated hearing loss, including social isolation, reduced quality of life, depression, increased tinnitus, cognitive decline, brain atrophy, and higher risks of falls. If you've been told that your hearing is normal, but you still feel like you're struggling, don't ignore it. The sooner we identify the problem, the more options we have to help. Your hearing health is too important to put off.